We often turn to alcohol as an antidote to life. We understand that it helped when nothing else could. If it's failing you now, it's not weakness. It's time to address the reasons you ever needed it in the first place.
We don't ask to perform willpower. We study what alcohol was giving you: relief, control, distance, and design something stronger in its place. The first step isn't saying no. It's understanding why yes became a necessity.
Alcohol can alter perception, but over time it blunts joy, distorts closeness, and turns relief into dependence, reshaping what it means to feel a life with joy and meaning.
The first phase is about clarity. We begin with a medically supervised detox and a full medical and psychological assessment. You are supported by more than 15 specialists, physicians, therapists, and experts, all sharing one record, one plan, and daily communication.
I think the strength about Paracelsus Recovery Clinic is the interdisciplinary approach. We don't look at one symptom or one organ at a time, but we look at everything from a holistic point of view. And we have a vast network of experts that all come together to look at you as a whole. And fortunately, if you come here early enough, what Paracelsus can really do well is not only to target the organ damage or the cellular damage, but also to allow behavioral change.
We live by triggers and patterns, and dependency is no different. Patterns in dependencies make sense when you see where they began.
There is so many reasons to use alcohol as there is clients. Before one takes alcohol away, one has to understand what the function of the alcohol use is. Nobody does the things he does without a reason, and before we start to intervene, we have to understand in every individual case what the use is about.
As regulation returns, the sleep steadies and mornings feel clearer, your emotional landscape becomes readable again. Stability brings confidence, and confidence opens a door to deeper work.
We look at key markers that consistently affect mood and focus: glycemic stability, micronutrient status, and inflammation. As a psychiatry is reporting changes, we refine the plan so the biochemistry supports the work of the mind.
Early recovery can feel over-aroused. We build a science-backed bodywork program: breathwork, therapeutic massage, and yoga, sequenced to your medical findings and therapy load. Like training, change consolidates in rest. We engineer those cycles so the deeper work sticks.
We can't control our circumstances, but we can show you what it means to be stable and present within them, without needing a drink to cope.
Evenings are where most patterns live, and where they begin to change. Each client works with a live-in therapist matched carefully to temperament and goals. They are senior clinicians trusted by CEOs, creatives, and public figures, trained to bring presence into the hours that once belonged to alcohol.
Together, we map out the cycle of addiction, the triggers, the stressors, the moments when the substance feels like the only option. And once that cycle is clearly visible, you're in a position to begin making different choices, the first real steps towards change, rather than being pulled helplessly along by a compulsion.
The work doesn't end when you leave, it evolves. Your same team stays connected, reviewing your sleep, focus, and mood, refining what's needed as life resumes. This continuity is part of the medicine, a living bridge between treatment and real life. Switzerland is not just a location, it's an active ingredient in your recovery. This country holds a centuries-old memory of health and sanctuary. We're not just a clinic, we are a part of a long tradition of restoration. There is a reason the world comes here to heal. For someone who's relied on alcohol to cope, a month without can sound impossible. We don't expect you to be teetotal right away. Our one client at a time program allows us to help you through the work, but at your own pace. For a high-functioning individual, a drop in your standard of living creates distraction. If you're worrying about your comfort or fighting the logistics of your stay, you're not focused on your health. That is unnecessary noise. We view comfort as a clinical necessity. We deliver our care in a private residence and partner with the Dolder Grand Spa, the best Switzerland has to offer.
We are the connective brain between your results and your plate. With our dietitians and chefs, we design a culinary healing experience you actually enjoy. Timing meals, balancing glucose, reducing inflammation, so you feel good while you eat and still feel good after.
This is integrated care at its highest level, designed to be seamless, measured, and highly personal. Discreet intake and secure communications protect privacy from the first contact. Our admissions line operates discreetly for clients and their representatives. If you're considering this for a loved one, we'll guide you through the first steps with absolute privacy. One call and the arrangements are in motion.
If you are ready to walk through this door, we will be here to show you what is on the other side.